Hi guys, Dr. Adams here, chiropractic physician at Miami Spine and Performance. I wanted to do our first at-home joint mobility class brought to you by Miami Spine and Performance. So today we're going to go through 3 moves. One of them is going to be a controlled articular rotation. One of them is going to be a Pales Rails, and the other is going to be an end range liftoff. Now, if you're not a patient of mine and you don't come to our clinic or you don't follow along with some recent training and rehab principles, you might not be familiar with these terms. These are terms from functional range conditioning, which is one of the modes of rehab and movement that we use in our office to assess and treat our patients. Today, what I want to focus on is hip internal rotation, okay? And the way you can assess your own internal rotation is you lie on your back, you're going to put one leg straight, and if I'm assessing my right internal rotation, I'm just going to turn my hip inwards like this. So my foot's going to be to the outside, my knee's going to stay pointed towards the ceiling, okay? So I'm not bringing the leg out like this, I'm not driving the knee forward, I'm keeping the knee in a straight line up towards the ceiling, and I'm just rotating the foot all the way out as far as I can. And whatever I have there is my active internal rotation. Additionally, when you're assessing, you don't want to be using your lower back to cheat, okay? So I'm going to keep a hand on my lower back, I'm going to rotate my foot. What I'm trying to avoid is this hip hiking motion, okay? Because that's not going to be true hip motion. That's going to be coupled motion between the hip and the lower back, okay? So the first thing I'm going to do for the hip internal rotation specifically is a sideline controlled articular rotation. And this motion is a exercise that produces mobility gains for all motions of the hip, because we are going to be hitting flexion, extension, external rotation, in addition to internal rotation. But it's a great way to warm up the joint, sort of activate mechanoreceptors and get that joint prepped and ready for what we're going to be doing next afterwards, which is going to focus on hip internal rotation specifically, okay? I'm going to go through 3 repetitions on each hip, but at home you could do as many as 5, 8 of these hip cars depending on how your hips feel and how much time you have, okay? What I'm going to do is I'm going to lie on my right side, okay? I'm going to make sure my head is supported. I don't want your head floating in space like that. You can just put your arms out like this. I like to clasp my hands. I'm going to use my hip and my shoulder to bridge up just a little bit, just to lift my lower back and my obliques off of the table. Then what I'm going to do is nice and slow, I'm going to bring that top hip into full hip flexion, go into hip abduction, internal rotation, and extension. Once I go into full extension, I'm going to drop that knee down and get a little adduction, and then I'm going to come back the exact same way that I came. Okay? And you guys might be watching and wondering, well, that doesn't look like a lot of motion, right? People, their hips can do more than that. But the idea behind the controlled articular rotation is that I'm moving my hip completely independently of my lower back or of any part of my body. So at first your range of motion might be more limited than you think, and I would like you to err on the side of being conservative and make sure that you really get the benefit out of the exercise, which is using your hip independently of your lower back and of other body parts like that. So let's go through our next 2. Build a little bit of tension in this upper body here. I'm going to reach out in front of me. I'm going to lift lift my midsection up using my hip and my shoulder. Get a big breath, trap some air low in my belly. I'm going to go through my second controlled articular rotation. Notice I'm taking my time. I'm feeling all the right areas. I'm not rotating my entire body. As soon as I get stuck, I go to the next motion, kick all the way back. I'm still maintaining the space here. I have some good intra-abdominal pressure, some good abdominal breathing going on. And then I'm going to extend the leg. One more time. If you're doing this right, your hip should be feeling like it's working a little bit. You might feel burn on the outside of your hip or in the front. Rotate. Come all the way back behind me. Drop that hip down. Feel a stretch on the outside of the hip. Bring it up as high as it'll go. External rotation. Back to flexion. Come on down. And guys, while I'm talking and switching sides, you can go ahead and do a couple more repetitions while you're following along. Now I'm going to go to my right side. If you guys are doing this right, you should be feeling sort of deep muscles in your hip working. You should not be feeling your lower back. Shouldn't be feeling your quads or hamstrings too much. It really should be this lateral hip, maybe a little bit in the front and a little bit in the back. So if you are feeling your lower back, the first thing that I want you to do, again, build that intra-abdominal pressure. So take a big deep breath, fill that lower and lateral belly with air, then proceed to continue to do the hip car. If you're still feeling your lower back after that, then I just want you to put your hand on your side like I'm about to demonstrate, and that way you can keep tabs on it and make sure you're not moving your hip too much while you're doing the hip car. I'm sorry, not moving the hip, using the lower back while you're using the hip. Okay, so your range of motion is exceeding what you're capable of. Okay, so the variation that I talked about here, I'm on my right side. I have a hand here just monitoring the activity, making sure I'm building some good pressure here through the side. I'm keeping my lower back relaxed. Bring the hip all the way up. Bring it out. Rotate the foot. Drop the hip back. Radiate some tension, reach out in front of me. Come on up. Rotate in. Come forwards. Do 2 more on this side. So I'm going to bring the knee all the way up. Bring the leg all the way out. Rotate that hip. Really feel the side of your hip working. Drop that hip down. Feel a little stretch in the outside. Again, I'm keeping this elevated. I'm staying active. I'm not just letting my body flop down. Come out the outside, almost like you're stepping over a hurdle. Bring that knee forward. Back around. We'll do 1 more for good measure. Bring the knee forwards. All the way out. Should be feeling the outside of your hip should be on fire here. Rotate that foot. Bring it all the way back. I'll come back the same way that I came. And I want to show you guys additionally another variation of the car that you can use specifically to work on rotation, and this is the capsular car. And what I like to do is I like to integrate the capsular car into the full hip controlled articular rotation. So the way we do capsule cars typically is we're just going to keep that knee pointed forward and we're just going to rotate the leg in and out, right? So we're going to be working the capsule of the hip, we're keeping our low back relaxed, and we're just feeling what it feels like for that femur, which is this thigh bone here, and the head of the femur, which is in a ball shape like this, to rotate within the socket and kind of clean out that area. And it's an area that a lot of people struggle with, particularly with internal rotation. So what you can do is you can actually set up from this hip car position, radiate a little bit of tension, lift the ribs up off the table, and I go up into this flexion position and I actually do capsular cars from the sideline position. So you'll notice there's not a lot of excessive movement of the knee. Just rotating the foot in for external rotation, rotating out for internal rotation. And over time, that one will begin to burn as well, but it should feel good. It should almost feel like a mobilization, because with a lot of people, their hip capsule doesn't get a lot of love. They don't do a lot of hip rotation. So once you start working in that rotation, it'll make your hips feel great, and it'll take a lot of pressure off of your lower back, which a lot of people that have lower back pain, whenever they go to use their hip, they end up using their lower back as part of that movement. So if we're able to dissociate the lower back from the hip and use the hip for hip things and the lower back for lower back things, then everybody plays well together and we don't have one area that's overworked and another area that's underworked. So now that we've used the sideline hip car to sort of open up the hip, warm it up, you also use it as a self-assessment to say, okay, what motions feel limited? How did I feel internally rotating? How did my hip flexion feel? We're now going to go into a 90-90 position, which a lot of people are familiar with, and we're going to work specifically on that back leg, which is that internally rotated leg, okay? So what I'm going to do here is I'm going to use some yoga blocks from my office to help enhance the range of motion a little bit. And I'm actually going to sit on a yoga block in the 90-90 position. And if you do have a yoga block at home, I highly encourage you to do this. So I'll put one yoga block under this top hip here, and I'll put the other yoga block sort of right under my butt. What I'm gonna do from here is I just like to spend a couple minutes hanging out in this position to start. And just because it's a position that does put a lot of pressure on your hip, particularly this back one, because most people aren't used to spending a lot of time in internal rotation. But it's important that you find something you can stack under yourself so that you can maintain upright posture. If you find yourself leaning to one side or being uncomfortable or feeling any sort of pinching in the hip, you always want to readjust the position. We don't want any closing angle joint pain here on the inside of the hip. So we're going to continue to spend some time here, and I just want you to explore a little bit. So lean forwards, lean backwards. Don't round the back, but just sort of play with different angles. Work on staying up tall, finding a good belly breath, breathing through that lower abdomen, breathing through the lateral abdomen, and just appreciating what it feels like to be at this end range position, right? And start to become particularly conscious of this right hip, okay? So if you're imagining your hip sits in the capsule like this, and when I'm in this position, my hip is rotating like this, right? So I want you to think about that hip actually being rotated. So it's not just flat, but the hip's actually rotated a bit, okay? So you should feel a little bit of the outside of the hip. You might feel a little stretching in the groin, depending on what areas are tight on you. And after we spent a little bit of time in this position, we're gonna go into our pales and rails contraction, okay? You can do this for a number of sets, but what I want you to do for the pales contraction is you're gonna radiate some tension, you're gonna trap that air in the lower abdomen, good intra-abdominal pressure, and all you're gonna do is you're gonna start to drive that shin and that foot down into the table, okay? From this position, and what you'll feel is, you'll feel some muscles in your glutes and in the lateral side of your thigh working. As you're driving that shin, that foot down into the table, you're actually driving relative external rotation from this internally rotated position. And that's what we call a pales contraction, okay? So I'm driving my foot down, driving my shin down, feeling the outside of my hip really working. We're gonna do that for 20 seconds, and then we're gonna go into a rails contraction where we're gonna actually drive the knee down into the table, and we're gonna try to lift that back foot up. Don't worry about it if you're not able to lift the foot up. It's more about what muscles you're contracting. So right now, I'm driving my foot up to the ceiling. I'm bringing my knee down. So if you can imagine, I'm rotating my hip this way, down, 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 and you should feel a ton of muscle activity on the outside of your hip. Those internal rotators are on fire. Again, I'm not compromising my posture. Driving, driving, driving. Good, and then relax. So in between pales and rails, readjust your position, and I want you to sink into a little bit more internal rotation. So I'm going to do that by actually turning my pelvis into that hip, right? So I'm creating more relative internal rotation, okay? Now that I found my new barrier, I'm going to go back into my pales contraction, okay? So I'm going to be driving my foot and shin down as I'm turned over that leg, driving the foot and shin down, 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 feeling a little more of a stretch in the groin now, and as well as some activity on the lateral thigh. So I'm gonna push, I'm gonna hold this for 20 seconds, driving, and I'm ramping up, right? I'm starting at maybe 30 or 40%, and I'm trying to ramp up all the way to 100%, really driving, but I'm not lifting this knee, I'm just pushing everything down. Then I relax, and I go right into my rails contraction from there. So I'm trying to lift that foot up, driving that knee down. So I'm going into relative internal rotation. At this point, I've turned over that leg a little bit more to get even more internal rotation. Drive, 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 drive. Lift, lift, lift. 3, 2, 1. Good. Again, from here, we're gonna find that next barrier. So I'm gonna turn my pelvis over the thigh, lean over it just a little bit. Got good pressure here. Abdomen's full. I'm ready to start my final pales contraction. We're gonna try to ramp up to maximal tension here. Okay, ready? Start driving that foot and shin down, feeling a deep stretch in your groin. Again, if you're feeling any pinching or discomfort, adjust the position. You should feel the muscles working really hard. You might feel a very intense stretch, but we don't want any pinching or closing angle pain. Driving down. Drive, 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 drive. 5, 4, 3, 2, 1. Good. And now I'm going to lift that foot, driving the knee down, maximizing that internal rotation, trying to use every little ounce of range that I have. Build good intra-abdominal pressure so we can explode that hip off of. And I want you to imagine again, we're rotating the hip. You're feeling it deep in the socket. 4, 3, 2, 1. Good. Once you've gone through 3 rounds of pails and rails and you spent a little bit of time in that position, you're going to go nice and slow to get yourself out of that position. You're going to reset yourself on the table, and we're going to switch sides. So again, I'm going to sit on the yoga block. I'm going to get my block under my right hip. That thing's feeling loose. And then I'm going to set up my 90-90 from the other side, okay? So I'm here. As you can see, my left hip is a little bit tighter. I have a little bit of a different angle here. So I'm going to focus on keeping an upright posture. And for this one, I might just spend a little bit more time in this position, right? I may just need to spend an extra minute or 2 hanging out here, just getting comfortable, feeling that internal rotation. Again, making sure that I'm not using my lower back, I'm just feeling the hip. I'll readjust the yoga block here. Again, guys, if you can invest in yoga blocks, your body will thank you later because there's a lot of great mobility variations. Most of my patients know that I recommend yoga blocks because a lot of the exercises I give for home involve the yoga block. So for this hip, I'm just going to hang out here for a little bit longer because I'm feeling a little bit of tightness on my left hip as far as internal rotation. And I'm just going to try to get comfortable. Before you start doing any of your pails or rail contractions, you really want to make sure that the hip is ready for it, so it's comfortable in that position. And so just have a little bit of body awareness. You know, if you get into a position and you say, you know what, this feels extra tight, I don't quite feel stable, I don't feel as good as I did on the other side, then spend a little bit of extra time hanging out in that position, okay? So now that we've spent a minute or 2 here, we're going to go into our pails and rails. Again, knowing this is a bit of a tighter hip for me, I'm going to keep the contractions at a bit of a lower intensity, okay? So I'm going to be in that 30-40% range, okay? I'm going to start with the pails. So I'm going to be driving, again, that foot and shin down, trying to drive relative external rotation of the hip. Ramp up, ramp up, ramp up. Starting to feel the glutes turn on. I'm not feeling anything in my lower back because I'm maintaining good pressure to keep that back protected. I'm using just the hip. I'm ramping, I'm ramping, I'm ramping. So right now the foot and shin are driving into the table, the knee is staying right where it's at, so I'm creating relative external rotation. Again, guys, it's not about movement. These are meant to be isometric contractions, so we just want to make sure the right muscles are turned on. Now I go into my rails, I drive that knee down, and I go to lift the foot. These exercises require a lot of cognitive awareness of what you're doing. You need to be able to feel, what does it feel like to really rotate that hip and drive that foot up, turn on those internal rotators, even when you're not moving, right? Again, shouldn't be feeling anything in the back, should be feeling the outside of your hip light up. And we're gonna relax. I'm gonna turn into that leg just a bit, just to create even just a centimeter more of internal rotation, takes us to that next barrier, and then we go back into our next rails contraction. So I'm gonna drive all this stuff, the bottom of my foot, the inside of my shin is driving down, 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 down. I'm feeling my hip almost want to externally rotate, even though I'm in full internal rotation. I'm gonna continue to drive that leg and foot down, 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 down. I'm gonna turn over into the leg. 4, 3, 2, 1, and then I'm gonna drive that knee down, lifting the foot up. Oof. You feel the outside of the hip should be on fire. Using all those small muscles, you're really maximizing your range of motion. Drive, lift, 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 lift. And you'll know it because you'll feel this one little spot turn on, and that's how you know you're doing it right, okay? So now from here, I'll find that next barrier. I'll just turn myself a little bit, create a little more even relative internal rotation, try to turn the pelvis as well, and then I'll go right into my pails. So I'm gonna drive down, I'm gonna externally rotate, keeping myself turned into that leg. So I'm at maximal internal rotation, I'm externally rotating, driving, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then I'm going to go into my rails, driving the knee down, the thigh down. I'm trying to lift that foot up, turning on the small muscles of the hip. This one I want you to ramp all the way up. Feel every little muscle fiber in there. All the internal rotators are on fire. We're activating all those motor units. Whew, a little cramp there. That's how you know you're doing it right, if you feel a little cramp, okay? And that's totally normal as part of these exercises. If you find yourself at end range, you're really maxing it out, you're ramping all the way up, you might feel a little cramp. Nothing to worry about. Grab a little bit of water, get right back into the position. That's just part of joint training. So the very last piece we're gonna do here as part of our internal rotation series for the hip is going to be lift-offs. So what we've done so far, we've used our controlled articular rotations, again, to sort of feel out the joint, clear out any restrictions we might have. The pails and rails is really our dense therapeutic intervention, right? Where we're gonna use isometric contractions at end range to actually improve our range of motion. And now we're gonna actually move the hip, right? So we're gonna do some internal rotation. So one variation that I like is you're gonna be lying face down or prone, and you're just gonna be doing hip internal rotation lift-offs, okay? So go into this position here. I'm gonna kind of lift one leg up, and all I'm gonna do is lift and hold, come down. And at this point, you should have a really, really good sense of what it feels like to internally rotate that hip. So you should have no issue using your hip independent of your back. We're just gonna go through 10 repetitions here, going as high as we can. We got 3 more. I'm just feeling this one focal spot, sort of in the outside of my glute, hitting all those internal rotators. Not compromising my posture, keeping good intra-abdominal pressure, and I'm gonna switch sides. I'm gonna go here, internally rotate. You can adjust your knee position based on how tight or how loose the hip feels, but this is a great way to finish off, sort of, and just kind of maximize that new motion that you earned through the cars and through the pails and rails. Lift and hold. As soon as you feel like you hit your barrier, you want to go a little more, because we know that last little bit of range is where you're going to have the most impact. Okay guys, so we've gone through our side-lying hip cars, we've gone through our 90-90 internal rotation pails rails, and we've gone through our end range lift-offs. So the last piece is the reassessment. So what I'm going to do is I'm going to lie on my back here on the table, and I encourage all of you guys to do this, even if you're not a clinician, if you're at home, assess before and after so you can see what kind of gains you made in your internal rotation, okay? So I'm going to lie on my back, and look at that. Right, so I feel a lot more comfortable with internal rotation. I feel like I gained a lot of motion there. Right there on this side. Again, this one's a bit stickier, but I do feel like, you know, probably a 5-degree improvement on this side, right? And it doesn't feel as stiff as before. I feel like I have more control of the movement. So a lot of the improvements that you make in mobility aren't just soft tissue improvements, but also your ability to control that motion. And what we're looking for in our office, and what you should be looking for in general, is not just to gain range of motion for the sake of it, but to actually gain range of motion that you can use in function, whether you are a runner, you play basketball, CrossFit, jiu-jitsu. When we're working to improve ranges of motion, we really want to be able to use them. And particularly with hip rotation, the most important thing we're looking at is our ability to move the hip independently of the lower back. Please keep an eye out, guys. We're going to be releasing different little segments like this for each body part and for different ranges of motion. So early on, we'll be putting a lot of emphasis on hip and shoulder rotation as well as the spine, but we'll even get into little nagging things like ankles, wrists, and things like that. So keep an eye on our Instagram and follow along. And if you did try out the program, please comment on the post and let us know how it went. Thank you.